Hi, Wendy. So it's so nice to have you this morning with the CBIA and BizCast. I'm so excited to have you today. I just want to start by talking a little bit about the fact that you are one of our main speakers for our When Women Lead event, which is being hosted on May 26th. We're super excited for the event because unfortunately, due to COVID last year, we didn't get to host it. So I wanted to thank you and Cigna not only for speaking, but for being a sponsor of the event. We couldn't put on these types of events without support from companies like yours. So thank you again for agreeing to be part of that event with us.
It is absolutely my pleasure, my honor to participate in this event. Like you said, there were so many events like this that unfortunately got canceled as a result of the pandemic. And while we're not completely out of the pandemic, it is so important to continue to have these types of events so we can continue to work towards a better tomorrow.
Yeah, of course. And, with that kind of introduction, I'd love to just kind of dive right in with you. So if you just wanted for our audience and for, the people who will be joining us for When Women Lead, if you want to just start a little bit by sharing your background, just a little bit about yourself, and then kind of your overview of your position with Cigna.
Sure. I'm happy to give a little bit of the voiceover of my career. So most of my professional career has been spent at Cigna. I won't divulge exactly my age, but let's just say it's a couple of decades. And I actually currently hold the position of market president for the state of Connecticut, which means that I have overall responsibility for all of our sales and distribution activities, all of our network contracting activities. So think about the ability to provide access and better rates for doctor or hospital care that folks are having. I'm also responsible for all of our community engagement activities here locally and working on government affair type issues, which obviously is key to CBIA. At the same time, while I'm running the Connecticut market, I also have the responsibility for leading another business at Cigna, which is referred to as Payer Solutions, which is our third-party administration business. So it's a little bit of a different business. It's a national business, but let's just say both of those leadership roles keep me quite busy at Cigna. But as I mentioned, right, I've been with the company for a couple of decades, and this is the role that I've aspired to achieve. But I started out, again, a couple decades ago in our financial development program. I joined the company. I am an accountant by background, and I joined into one of our many leadership programs. Very early in my career, that gave me the opportunity to really understand our business, how we serve clients and customers, how that drives top and bottom line earnings and growth and things that are really important to fuel our company that allows us, to be able to then give back to our communities. Through the course of my career at Cigna, I moved from our a financial-oriented role. I had the opportunity to move into our clinical operation, really understand the heart of what we do as a company in terms of helping people with their care, and then had the opportunity to be in our solutions area, which really gave me the opportunity to understand how we solve problems and how we take those problems and solutions and bring them into the market, and again, sell them to employers and help customers. All of those experiences prepared me to be able to take on the role that I have today in terms of leading these two businesses for Cigna.
I just kind of want to touch in, you described kind of, your buildup in your career to kind of facing these challenges. So we're just going to deep dive right into COVID and kind of what your response and the team at Cigna has kind of dealt with in the last 15 months and kind of what you guys were faced with, not only your response, but if you want to touch a little bit about, employee mental health, kind of the social unrest. Take it away. Tell me what you want to talk about.
Yeah, no, absolutely. I mean, I think we would all agree that the last 12 to 15 months has been like no other, right? We will all look back on this time and we will remember the pandemic, and then on top of it, the social unrest, as you said, political divide, right? Natural disasters, right? This has definitely been one of those years that all of us will remember. And, I think back to, it was March 13th, when the order came out, send all your employees home. And, I talk about this a lot with folks. There was no preparing for that, right? If you think about how, as organizations, you take on major initiatives, there's a lot of planning, project teams and timelines and milestones and governance and all of that. There was none of that. It was boom, send everyone home like that. And, what we first needed to do, and I use this example a lot, it's like being on an airplane, right? When the oxygen masks come down, it says, first put the mask on yourself so then you can help others. And that's what Cigna did initially, right? So in the early days, it was making sure that our employees had what they need. Did they have computer setups? Did they, have a comfortable work environment? Were they able to do their job, but not be in a physical location? As soon as we ensured that our oxygen masks were on our own employees, we then immediately pivoted to figure out how we ensure that we take care of all of the stakeholders that we serve. So we wanted to make sure that our clients and our customers had what they needed. If you think about customers, there was a lot around getting COVID testing, and we wanted to make sure that there was not a barrier, a financial barrier for folks to go and get the needed testing. So we quickly issued communication, no cost share on COVID testing, treatments, et cetera. That's a great example of the kind of work we did to ensure that we were helping consumers during this unprecedented time. From the provider perspective, right, they were providing such an important service, right? They were helping people during this time, and their operations were literally being turned on their heads as well. So we wanted to make sure that we were removing every single barrier to their ability to provide care. So we took down barriers like prior authorization and other things that could get in their way. So that was, how we wanted to make sure that we were helping the providers so that they, again, could help the country deal with this. And then, another thing I'll just highlight is many of the not-for-profit organizations that, during that time, folks were diverting resources and they weren't able to have the money they needed to continue on with their important programs. So we found ways to actually give, whether it was time, whether it was money, resources, whatever, to ensure that the good work of those organizations continued. So those are just a couple of examples of how we responded to the pandemic.
So obviously there is a team around you that kind of, you weren't the only person obviously kind of doing this response, but I do want to talk to you a little bit about kind of the things that, the skills that you kind of developed over your professional career that kind of put you in a position to be able to address some of these challenges and deal with them head on.
Yeah, Molly, it's such a great question, right? Because as I said, there was no preparing for this. It was boom, you're home. And how do you lead through that, right? Because not only did I need to lead the team, but I was dealing with what was going on in my own house, right? So I had a daughter who she was sent home from college. Now, all of a sudden, she's in literally the next room, right, finishing her schoolwork. I had a high school senior who his whole entire senior year was just upended, and he was finishing out his career, right? We were all now under the same roof trying to figure out how we do our thing, right? My husband had to continue to do his job as well. And at the same time, I had to figure out how my team had what they needed and how we were going to continue to ensure that the clients and customers and providers that we serve also had what they needed. And, you said to me, how did your experience, how did that help you? And when I reflected back and I thought about, okay, how do I do this? How do I move forward? I really did rely on some of the core themes that I've always used throughout my career. And it's this notion of focus, team, and tools. Those are three key topics that I always think about when I think about leadership, right? Focus. Are we focusing on what matters most? Because there's so much going on. How do you ensure that you're focusing on the things that matter most at this moment? And guess what? There were things that we had been focused on that no longer mattered or needed to be reprioritized. But that notion of focus continued to help me as I led through the pandemic. And we constantly needed to ensure that our focus was on the right thing. The notion of team, right? You cannot get anything done unless you have that team around you. So making sure, as I said a moment ago, the team had what they needed. Was everyone okay? Where did we need to lean in because somebody was dealing with a child who, had to get their schoolwork done? So covering for folks, making sure that people had what they needed and that people felt supported. And then tools. Did people have the tools they needed to get their job done? So while the things under each of those categories may have been different with the pandemic, the lessons around those key areas of focus really helped me as I led through this pandemic.
I love that answer. You always kind of keep some of those tools with you throughout your career. So I'd love to kind of just get a little bit, into the challenges that you've faced as a woman in the corporate world. You talk about the tools that you've kept, but what are kind of the challenges that you had to face, to learn these lessons for that?
Yeah, so, I love this question. I love talking about this, right? Because there's this drive for, women in leadership, and, companies are definitely focused on it. Cigna's been great at ensuring that we're increasing the representation of women in the ranks, and certainly a great example of that. But there's this piece that you need to own, right, as a woman. And, one of the things maybe that I'll talk about is this notion of being courageous and being comfortable, being uncomfortable. And it's something that I've had to do throughout my career and really lean into that. So, I mentioned, leading two businesses at Cigna. And when I took over these businesses, I didn't know everything I needed to know. There were things about the job that I had never done. So I mentioned market president of Connecticut. I'm responsible for sales and distribution. Well, guess what? I walked through a little bit of my career profile. Did you hear sales in that career profile? You didn't, right? So now I'm leading a sales organization, but I've never actually been in sales. But what I was able to lean on is some of those other experiences around, well, what is sales really about, right? Sales is about influencing people to make a decision. And I had tons of experience around having to influence people. So I was able to draw on experiences that aligned to things that I didn't know. And then also really, really important, I surrounded myself with people who did have those technical skills and knowledge. And I was very humble about acknowledging what I didn't know and asking for help, even as a leader, asking for help. So it's okay not to check every box in terms of the experiences before you take that job or raise your hand for that next opportunity. So that's a great lesson that, I would give to the audience, and something that I've pushed myself, getting comfortable being uncomfortable. I say to people, if you don't have those butterflies in your stomach when you're taking that next job or seeking the next opportunity, you're probably not pushing and challenging yourself enough.
Thank you for that, Wendy. That's a great answer. I think as, a young woman in my own career, I wouldn't be here without pushing myself and kind of coming to terms with there's going to be discomfort and you can't just live in the comfortable areas. So thank you for that. So I want to just talk a little bit about, something that you kind of took for the forefront in the pandemic. You were quoted in the Hartford Business Journal as saying, as market president of health insurers Cigna Connecticut, you have created discussion groups to help employees learn more about colleagues from different backgrounds. So I kind of want to know what those look like and how do you think those groups have been successful? Yes or no?
Yeah, and thank you for asking me that question. I'm glad I said yes to one more, because this is something that's been really important and something that I've actually been really proud that I've been able to have a part in this. So when obviously all of the social unrest of last year and when George Floyd, et cetera, hit, there was this moment of how do we actually allow for the right conversation? And people, again, go back to being comfortable, being uncomfortable. I was super uncomfortable, right? I'm obviously a white woman and I can't relate to some of these situations that Black folks were dealing with. So how do I help? How do I learn? How do I engage in a conversation? So what we started to do was create inclusive conversations that allowed people to share their experiences, that allowed others, including myself, to actually break down some of the unconscious bias that exists. Right? And unconscious bias isn't a bad thing. Everyone has it. You have it because of the experiences that you have. If you haven't had the experience, right, that's what creates unconscious bias. The only way to break it down is by opening up and listening and understanding other people's experiences. So we created these safe spaces for people to come together. We actually used, there's a Netflix documentary called The 13th. We actually used that as our jump off point for the conversation. So we pushed out information. We asked everyone to watch the documentary, which I found fascinating. And then we brought folks together to discuss the documentary, but obviously it led to people really opening up and sharing their stories. And I can't tell you how much that has helped me personally, and I know it's helped others, because again, only by listening do you start to understand where you can break down those unconscious bias. So we started those obviously last year as a result of a lot of the social unrest that was unfolding, but we're actually committed and we're continuing to have those conversations on a go forward basis, because as my boss has so eloquently said, we wanted to ensure that it wasn't just a moment, but that we created a movement. So we've got to continue to have these kinds of conversations.
And I think too, Wendy, it's super important because, the better that we understand kind of our colleagues and coworkers, we just have a better chance to make not only business successful, but kind of improve the economy, when everybody feels like they're getting equitable share, that's really how we, move forward together. And finally, I just want to do kind of like a rapid fire, fun, quick question for you. So it's Friday. It's a beautiful day. I kind of just want to know what your ideal weekend looks like and what do you think would be the best weekend for you?
I love it. So actually, and I'm fortunate to be able to take advantage and do one of my favorite activities on the weekend, especially with the sun shining, as you said. So we're a boating family, and we just put our boat in the water not too long ago. So getting out on that boat this weekend is definitely high on my list.
Ah, that sounds great. Well, the weather's supposed to be great tomorrow, so hopefully you'll get to enjoy that. Wendy, thank you so much again for joining us. Again, you'll be a featured speaker at our When Women Lead conference, which is being hosted on May 26th. Cigna is a sponsor, and thank you again for your time. We're so excited to have you and learn a little bit more about your story on the 26th.
Sounds fantastic. Enjoy your weekend, and thanks again.
You too. Thanks, Wendy. For the latest Connecticut business news, events, and resources, visit CBIA.com. Follow us on Twitter at CBIA News and on LinkedIn and Facebook. Contact us anytime at 860-244-1900. Thanks so much for listening.